Skin incisions are performed with a number 10 or number 15 blade. The incision is beveled very sharply at the hairline so that trichophytic closure can be established. Posteriorly, along the posterior hairline, the incision is beveled in a trichophytic fashion. The skin flap posteriorly is raised in the subcutaneous plane, external to the sternocleidomastoid fascia. Dissection in the posterior triangle, posterior to the posterior border of sternocleidomastoid and anterior to the trapezius muscle, must be carried out in the superficial subcutaneous fat. Dissecting too deeply within this fat, or cautery within this fat, must be carried out very carefully, as the 11th cranial nerve has no fascial covering and is found loose and redundant and buckled within this fat. In this portion of video that's been sped up, the subcutaneous dissection is carried out anteriorly to rejoin the submental subcutaneous dissection. In this patient, a deep plane facelift is planned. For the purposes of the video, the lateral orbital rim and angle of the mandible are marked externally, and the line joining these two landmarks will be the transition point into the deep plane. The anterior lipocutaneous flap is now elevated, taking care over the temporal fossa to prevent entry deep to the superficial temporal parietal fascia. Once lipocutaneous flap undermining is complete and has reached the line joining the angle of the mandible to the lateral orbital rim, attention is turned to the deep plane portion of the procedure.